This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask? We have the answers. This week, we're doing something very different. It's part of our new series, the POV series. We're doing an interview with a prostate cancer survivor. I'm Dr. Kevin Chun. I'm joined as always with my co-host, Dr. Justin Dubin. What's up, Justin? Happy New Year.
Happy New Year. I'm excited for this, So this is our first in a series of point of view series where we're talking with people who went through men's health issues or urological issues. And this one is a focus on a urological issue. And the goal here is really to have someone who's gone through it to make people who are worried about these kinds of things feel more comfortable. It's about normalizing these kinds of conversations and kind of learning from those who went through it. And I'm really, really lucky that we have Sammy here today, who's a friend of mine, a family friend, and we've known each other for many years. We're going to be talking about prostate cancer specifically. And, prostate cancer is a very, very common disease, as we've talked in the past. And a lot of famous people that you all know of had prostate cancer in the past. For example, Ben Stiller, Robert De Niro, Joe Torre, Arnold Palmer, and Warren Buffett. These are all guys who have had prostate cancer, been treated for their disease, and have spoken about it. But I thought it was a really unique experience to have Sammy join us today, and we're really thankful to have him on to kind of just go through this whole process from the beginning to the end and see how his experience and learn from it. So, Sammy, thanks for joining us.
Hi, Justin. Hi, Kevin. Happy New Year to both you guys.
Dude, we're so happy that you're here to, join us on this inaugural episode. I think you're going to share so much insight and, so important things to not just men out there, but also to physicians. Us on this side, we don't really maybe know from the other side. So I think we're going to learn so much for everyone, and we're so thankful that you're here to join us today.
Okay, well, hopefully I can help. See how it goes. Thanks.
So, yeah, let's see. So just like, if you want to give us a little bit of a background, I know obviously you're over in Boca, but how old are you now? How old were you when you were started getting screened for prostate cancer? And let's start it from there.
Okay. A little quick history. First of all, I'm presently 68 years old. Originally from the Pennsylvania area, transplanted to Florida. And my procedure was when I was 66. So that being said, I started screening roughly around the age of 48. Okay. And the reason I started screening was my father had prostate cancer. His brother had prostate cancer. Which was my uncle. My uncle passed away at 91 from prostate cancer. Now, most people don't die from this if they take care of themselves, if they address it. At the age of 72, my father addressed it, and he went through a procedure. And I basically saw firsthand how he fared with that particular procedure. And that's really what got me started in the screening portion of it. I felt it was a hereditary thing, and I've heard through other doctors and other people in general that it was a hereditary thing. So I thought I'd be proactive and check it. So that's how I really started to be concerned about this, issue.
No, that's a great point, and Kevin will back this up. Family history is one of the increased. It puts you at a higher risk for prostate cancer screening. So everything that you did sounds great, and and that's important to realize. Yeah. Exactly. So a lot of people don't know that if you do have a family history, think about it. These are things you should be thinking about and talking to your doctor. I guess the follow-up question is, who were you talking to? Were you talking about with your primary? Did you start getting screened? Did you see a urologist? Who were you seeing at the time?
It's kind of weird. I had gone to a luncheon where there's a urologist as a guest speaker, And not that he was pushing the business, so to speak. He just said that it's very important to have a PSA every once in a while. And that's what first got me thinking about it. Now, I was probably 35 or 40 years old when I saw this guy actually give a presentation. And at the time, I thought, I don't need to check into this. It's not a problem. Then I found out later on that my father had, in fact, checked, and his PSA numbers started to slowly increase. So I kind of saw, the procedure, how it worked, and that's what got me thinking about it. Now, to tell you the truth, I didn't have my first PSA screening until I was about 48 years old.
So,
and I
arbitrary. So that's great. At 48 years old, you had your first PSA. So how old were you when your doctor actually told you that your PSA was abnormal and that we would need to take further steps in the workup?
Well, it was a little bit of a history. At 48, I started getting PSAs, and I would do it every maybe 2 years, and the numbers would slowly increase. It started out at 48. I was a 3.6 or something like that. And then when I checked at 50, it was a 4.1. And over a 12-year period, it went from there to an 8.1. So when it went to an 8.1, I knew that I needed to do something, special. And that's the first time I went to a urologist to talk to them specifically about cancer, period.
Right.
So with that examination, he's the one, and this was in, where I previously lived. He was the one that said, the only way you can be sure is basically to have a biopsy. And I'm like, I don't need a biopsy right now. It's not an issue, et cetera, et cetera. Well, lo and behold, a couple of years later, I was overly concerned about it. And I thought, well, we'll do another screening. And the numbers were still high. My PSA was still high. And believe it or not, at that point, I met Justin. And Justin kind of said, well, you don't really have to worry about it, but to be on the safe side, maybe you should consider it. So after, thinking about it for a little bit, I considered it. And that's how we got into actually doing, well, originally it was an MRI, and the MRI showed something. Actually, it showed that I had a mass, okay, which was about 17 to 22% of the size of the prostate. And at that point, the only way to be 100% certain what it was the biopsy route. So that's how I got to do the biopsy.
Right. And you bring up an excellent, this is a, textbook stuff for us and a lot of people, and you're not alone in the fact that, people's PSAs, they go up, and the last thing that they want to hear is that they got to get a biopsy because that scares the shit out of them. Yeah, they don't want to deal with it, right? Yeah. So, we've seen so many people who, let's just wait, right? And that's exactly what happens. Right. Sometimes it works out, sometimes it doesn't. It's our job to kind of guide you in the right direction. I'm glad we talked and you got the biopsy, obviously. But back to, so I think Kevin's going to follow up with a question here, but, I think it's important to note, the MRI is very, very helpful. Unfortunately, not everyone has access to it. It is an extra tool that we are starting to use in our toolbox in searching for prostate cancer. And I'm glad that kind of pushed you over the edge to decide to get the biopsy. Mm-hmm. But I guess the question we really have now is, what going up to that biopsy and then into the biopsy, how was that experience for you? Because I think that is when you talk to people, that is the thing that prevents people from going any further in the process. They don't want to get the biopsy.
And to be honest with you, that's exactly what happened to me. When he said biopsy, I'm like, no way. But in the long run, again, I know my family history. I saw my numbers, my PSA numbers slowly increase. when the MRI said that there was a mass in there. It wasn't big, but there was a mass in there. I thought, well, the next step would be to find out 100% whether or not I have a problem. Right. Did I want to go for the biopsy? Absolutely not. I was not.
I don't think we blame you.
Just the thought of it. I'm like, no, I don't think so. But after going through the process, I think I was more nervous about the thought of the biopsy than the actual biopsy.
So, Sammy, I'm gonna hold you right there. What I'm going to do first is explain to maybe some of our listeners who don't maybe know what a prostate biopsy entails. So I'm just going to go over it real quickly, and then Sammy, you kind of guide us through how your experience was. So, generally a prostate biopsy is a procedure that's done in the clinic. Most of the time, there's no sedation involved. It's just with some lower lights, maybe some music if your urologist is nice, and basically a ultrasound probe is then placed into the rectum, and for approximately 10 to 15 minutes, the prostate is sampled. Now, certain times, if there's an MRI guided image for you, then it may be a little bit longer. But basically, the needle will fire through into the prostate. Some anesthesia is given through a needle, it's all through the rectum. And the urologist does his best to numb it up. But like Sammy touched upon, the thought of it to me, to Justin, I'm sure, is not pleasant. So
it was a scary thought, yes. But just to go back to what you were saying about the needle, the only thing I felt at the time, other than a little bit embarrassed, but the only thing I felt at the time was a very, very tiny pinch internally, which I guess was the local anesthesia. That's all I felt. Then I heard something that sounded like a stapler. And I'm assuming taking the biopsy.
Yes, that's the biopsy needle going in.
Yeah. Right. So I heard that stapler 17 times.
Okay.
So you counted.
This guy's taking it apart. And
you don't forget the number. Like a lot of patients say that they're counting. They're like, how many are we doing? And I'm like, oh, we're going to do 12 or we're going to do 16. And they're like, all right, 4 more left. Let's go. But overall, the experience wasn't terrible then for you, or better than you thought?
It was predominantly painless.
Okay.
You go into a room, you lay on your side. When they inserted things, you didn't really feel it. The little pinch that I was talking about, I'm assuming was the initial needle. Once that little pinch was done, I didn't feel really any pain whatsoever. And I didn't feel anything after the fact either. There was no soreness. There was very little bleeding, all of that. So the bottom line was the biopsy wasn't as bad as I thought it was going to be. Simple as that.
That's great to hear.
Yeah, I mean, that's awesome.
But as far as the actual procedure and the result, the one initial pinch is the only thing I felt, and it was less than getting a needle in your arm. Believe me.
I mean, that's real great to hear. I'm sure Justin can echo. Like we see a lot of patients who are, they're worried about the biopsy, and you're sharing that experience. I think should be reaffirming and comforting to listeners out there.
Yeah, I think a lot of things with medicine and surgery and when needles, it's the buildup and the idea of it. Yeah. A lot is often worse than the thing. Listen, we're not saying it's a walk in the park by any means. You still have a probe up your butt and stuff like that. But I think when it comes down to it, it's very reassuring what you're saying is like, if you had to do it again, you would do it again because it's important and it wasn't, right? I mean, I'm not going to speak for you. You can tell me.
I mean, it was a life-saving thing, in my opinion. Right. And if I had to do it again, I certainly would do it again.
Right. Exactly.
I wouldn't like the thought of it, but I would do it again.
Right.
I've had worse experiences in my life.
All right. So that's good. I mean, may we all have worse experiences in that. All right. So, you get the biopsy.
Right.
obviously there's some time period there, the waiting process. How long did you have to wait for your results? And then how were you delivered the news?
Well, let me just say I did a little bit of research to find out about the biopsy and what they were. Okay. I knew nothing about the Gleason scale.
Okay.
I didn't know, how they determined what was bad and what was not so bad and what was terrible and what was like, you need to do something right away. I had no idea. So I did a little homework to find out about things like the Gleason scale and what it meant. I guess it was about a week later where I was notified that, I had a 3+3 on the Gleason scale, and it showed all of the biopsies and what the scale was on each biopsy. And I would have to say I was about 50-50. At that point, I was 50-50. What should I do? In my case, my Gleason scale was a 3+3, which meant it was a very slow growing cancer. And I had time to make a decision what I really wanted to do. And at that point, I, looked at videos and I did some research and I read pretty much every clinical word that had to do with the Gleason scale and
right.
what decision to make.
That's so important. I think that's so important to highlight, Sammy, that you also did your own research. You looked up information and all that stuff. And that's very important because us doctors, we will share what we know, our knowledge base, but it's also important that you do your own research and we all come together and have a good conversation. And that's how we can kind of guide treatment, advice, and all the recommendations moving forward.
Right.
I agree because, at the end of the day, I mean, we're only in the room with you, even when we give you the diagnosis for 30 minutes, usually max. So it's important that you understand and that you do your own research in terms of that, but it has to be good research, right? There's a lot of bad stuff out there too. So you have to always be careful, but we talked a lot about it, right? Like you and I talked, I read your pathology report. It was Gleason 3+3, but the problem was, even though it was a slow growing disease, I think you had it in almost every one of your cores for the most part, every one of your biopsies. So it was right. Yeah, 12 out of 17. So it's a lot, right? So there's always worries. It's high volume disease. And when it gets to that, there's always concerns of what to do, right? In a lower Gleason score, and we're not going to go too in depth here, but there's that thing that we discussed, active surveillance, watching it, continuing to see what happens, or surgery. And that was the decision that you had to make. But I want to quickly go back to when you got the diagnosis. How did you feel? What was going on? Did you expect, based on the MRI and the other stuff and your family history, did you expect it to be prostate cancer? As kind of depressing as that sounds, how did you feel at that point when you got the diagnosis?
Well, I honestly felt, I'm not going to say depressed, but very down about it. I knew that I would have to face this fact eventually. I thought it would be later in my life. I thought I would have time to make a decision as far as how to handle it. But initially when I found out and I looked at the report and I did an evaluation on my own, I knew at that point I needed to do something about it. I didn't need to do it immediately. Right. It wasn't an urgent situation, but I knew I had to decide, what path I needed to take at this point. And I think, once you get over your little bit of a depression about it, you face reality and you say to yourself, okay, what's my next step? So to answer your question, I didn't feel so great about it. I was down about it.
I think that's reasonable. Yeah.
Very reasonable.
But, move on to the next phase or step or, make a decision. Where do I go from here?
So on that note, where do you go from here? I'm sure the surgeon, provided the options, which was surgery or radiation.
Yeah.
And so what was kind of going through your head in terms of the different treatment options for prostate cancer?
Well, knowing what my father did, he chose radiation. I saw, kind of what he went through. It wasn't bad. And at that time, we're talking about 20 years ago, at that time, it was a great procedure. It was something that, in his opinion, was not a negative thing. It was more of a positive thing. But since he had it, and now there's been a lot of advances. The bottom line was, again, I did my research, and I actually contacted 7 different urologists, sent them my report. I have a relative that works at the Mayo Clinic, and I sent the report there. I had the urologist there take a look at it, and all 7 recommended surgery. All 7. There was no one that talked about anything other than surgery. So I was curious why, and basically they said that you caught it fairly early. There wasn't an emergent need. You're healthy. You're relatively young. Not that 66 at
You're
the time.
young. You're young. Come on.
Yeah.
Yeah.
So anyway, I made a decision to do the surgery after discussing it with quite a few people. At that point, I didn't rush into it. The holidays were coming up. I didn't want to have this affect my holidays, so I chose to schedule surgery after the holidays. I believe it was early March.
Yeah, we talked about it too, right? I mean, when we talked about it, you said, "When should I schedule this?" I said, "Listen," and you said, "I want to do this when I feel comfortable." And I agree with you. I think that for what your situation was, there was absolutely no emergency. You don't need to get it done in the next 3 weeks or something. And
right.
and I think that you were in a good place. You wanted to be with your friends and family on the holidays, and then you booked it afterwards. And I don't think that there's anything wrong with that.
Church, what the surgery was all about, and when the time came,
Right.
I was knowledgeable about it. I could discuss it with you and other doctors, and I kind of had a feeling that, okay, if this is the path I chose, I wanted to know exactly how it worked. So that would be the next step here. But the bottom line, I made the decision. I knew it wasn't emergent. I didn't want to interfere with my schedule, and I basically picked the time frame. So, because it wasn't an emergency, I felt like I had all the time in the world to make an educated decision on how I wanted to deal with it. So, the end result was I chose surgery.